following segment is sponsored by Ward MD and Form Derm Spa. I am here chatting with Dr. Iorio and Dr. Powers. Thank you so much for joining me today.
Yes, thank you. Thanks for having us.
We are so happy to have you here. Okay, we're talking about facial plastic surgery, and I know there's lots of stigma and trends, so we're going to cover it all, but let's first talk about what are the most popular facial plastic surgery options? Let's start with you, Dr. Powers.
Yeah, you know, we tend to do quite a few different specific options that are out there, one of which is rhinoplasty. Then a lot of people, we kind of all-encompassing talk about aging face. So as we all age, our fat kind of descends, our fat pads, our volume changes. And so really that includes facelifts, brow lifts, and blepharoplasty, which would be to open up the eyes and kind of get rid of excess skin.
Sure. Are there any others that you wanted to mention too?
So with both of those, like I also like to do lip lifts with aging face because
lip lifts.
Yes. So like so many women now are getting fillers in their lips, which looks great if you need it and everything, but that can only do so much. But same as Dr. Powers was talking about, the skin changes, your upper lip also descends with time, and so you can actually make your lip fold out more with a lip lift.
Well, gravity is not on our side sometimes, is it?
It is
and
not.
Both of you look amazing, so I was like, you obviously know what you're doing. Now, do you have your favorite type of surgeries to do? Dr. Powers, let's start with you.
Yeah, I personally love rhinoplasty. I think that that's so innate. Everything's very detail-oriented. You can have one suture that really changes the tip shape, and I just think that that's such a rewarding surgery, both for the nasal breathing standpoint as well as sometimes we do it for the cosmetic standpoint, and oftentimes it's for both.
Sure, and I'm sure it's updated by now, right? I remember 10, 20 years ago, it was you were down for a month, and you know, it's probably a lot easier now, right?
The recovery's a little bit difficult for that first week. You're still going to be very congested, feel kind of like a bad sinus infection, but that sharp pain and kind of some of the pain control we've really kind of advanced in.
And the results are definitely worth it. Dr. Iorio, what's your favorite to do?
I actually love aging face. So facelifts, lip lifts, eyebrow lifts, blepharoplasties or eyelid lifts, mostly because facial plastic surgery has such a stigma with it. But for aging face, it's not about changing you, it's just giving you back who you wanted, who you once were. And so it's just trying to take some time off. So the way that I like to describe it, people, is if you were lying in bed at night and looked at yourself in the mirror, that's how we want you to look.
Oh, just lifted.
Yes,
just fresh,
exactly.
Right?
And so that's fun, because you just get to give people back what they wanted before without changing them. They're perfect, but just taking them back in time.
And what are some of the stigmas with plastic surgery that you're seeing?
People always think they're going to look pulled,
right,
overdone,
not like themselves,
or plastic, right, in a way that it looks like there's no wrinkles at all, and they're windswept, right?
Yeah, in a wind tunnel.
In a wind tunnel, exactly. And oftentimes we've had a lot of conversations kind of really resetting that expectation and kind of reviewing what's out there in terms of the anatomy, and what we do in terms of our technique is not looking for an unnatural appearance. We're really going for something, again, like you were saying, restoring people to kind of a more natural state, but lifted and kind of rejuvenated.
Lifted and rejuvenated.
Yeah,
that's what you want to see. And I'm sure you're seeing, I mean, it's just life-changing for your patients, right?
Yes, it's amazing. Changing little structures in the nose, like she said, one suture can change someone's entire appearance, and that can kickstart their whole new life, whatever they're hoping to do, even if it's a young person. Like a rhinoplasty can change their future.
Well, you're both doing magic work. Thank you so much for helping out your patients. It's so great to see you both. Thank you for the information. And if you'd like to book a consultation, make sure to go to the website on your screen. Thank you so much both. Great to see you.
Thank you.